Good afternoon, everybody. My name is Christina, and for those who are not familiar, I am the Director of Surgical Operations for Pain and Spine Specialists of Maryland. I've been doing pain management for well over 20 years now, and I've been working with Dr. Sudhir Rao, or as we call him, Dr. S. Rao, for the last 12. And then for the last 7 years, I've been a patient of Dr. Jyoti Rao's, who we call J. Rao, who currently sees me as my primary care and my wellness specialist. For some of the pain patients out there that are watching this, you may be able to relate. I've had chronic pain for many, many years. In fact, a lot of my MRI looks like the MRIs that I see on a regular basis when interviewing patients. I have the herniations in the disc. I've got the degenerations of the disc. I've got the arthritis in my joints. And I've got some vertebrae that have shifted. And for those who have no clue what I'm saying, all this equals pain, pain, pain. It all gets translated to the nerves that flow into your extremity, which causes pain. I have been treated, and the most of my pain has been held at bay for many years simply by going through the epidural injections and then the medial branch injections, which the epidurals will help me with the inflammation of the nerve, as well as the medial branches will help with those little tiny axial nerves that come out of those joints. So it does provide relief. And then I recently had the radio frequency ablation, or as we call it, the RFA, which is the treatment for the arthritis in the back. So I've had the gamut. And at one point in time, it came down to me starting to count down the days before I would be able to receive another steroid injection to help me with my pain. For the most part with my pain, I have been treating it with some patches and some compounding cream. It seems to be the only things that, help me. I don't even remember to take my Synthroid, so I wouldn't even think about asking for like a medication at this point in time. So I think that between the injections and the physical therapy that I have received, as well as the patches and the creams, I've been doing very well. Up until recently, the last year, my pain changed, and when it did, it shifted to the point where there was no relief. I found no relief when laying down. I found no relief when standing idle. As long as I was moving or sitting, I was fine. And for those who know me very well, because I'm usually in the procedure room with you, assisting Dr. S. Rao with procedures, you know that I'm constantly moving. And here's a little secret. And that's because when I stand idle, my pain increases and it's very hard to control. So you may think that I'm just bending over to pick up a piece of paper on the floor or walking around for whatever reason, but I'm going to give you my secret. It's because I'm in pain. So we came up with a pain treatment. I'm also a patient at Pain and Spine Specialists, seen by the physicians there, and I've received procedures from both Dr. Butternuth and Dr. Rao. And they've also been very, very helpful with kind of like, making sure that, I get my MRIs and I'm doing everything I'm supposed to be doing to, keep my pain at bay. But then Dr. J. Rao was stating that in addition to the injections that I was receiving, to try something new, and that was we did something called exosomes. And once again, this is not going to be a tutorial about the exosomes. It was my understanding, because I've worked with patients who have received them, that it rejuvenates the bad cells and tries to repair what's wrong. And then one of the patients who came in for one diagnosis came back to follow up and stated that other things started happening, such as she had some blotches that were on her skin that seemed to start to disappear, and some of her cellulitis started disappearing. So when Dr. J. Rao and I started discussing this, once again, insurance didn't pay for that. It was a conversation that I had to think about because, once again, it could be considered to be expensive. But, and my daughter said it best, at the end of the day, how much do you pay for your health, and how much would you pay to have quality of living? So I got my credit card or my credit care card together and spoke to Dr. Rao, and we made an appointment for him to inject the exosome. Some of it was intravenously, and then the second part was into the joints, which caused me quite anguish. So I will tell you that I expected to wake up the next day feeling like I was 20 again. That did not happen. It was about a month when I happened to be in the OR with the physician with patients that day, and normally that is where my pain begins, is if I'm standing upright and not moving. And I happened to notice that I was able to stand for more than 10 minutes, which may not be a lot for most of you, but that's huge. I became very excited, and then I was showing the other staff how I could just stand idle and I had no pain. I called Dr. J. Rao and Dr. Sudhir Rao, just almost in tears by the profound appreciation that I had that they took the time to devise a plan that would work best for me. And those out there that suffer from chronic pain, you understand there is no quality of living. It goes hand in hand with depression, because what you once could do, you can't do. And then you have to turn around and start asking for help. So I have learned to humble myself and ask when I need it. And so I did. I asked them to help me, and between the exosomes and the procedures that I received and the physical therapy that I went to and learned exercises, I will tell you that I am about 80% better. Now, I wasn't expecting a miracle, and I will tell you that I will be saving my money, because if God forbid anything, the pain comes back, I would want to move forward with the exosome treatment again. And a side note, in addition to the pain relief that it provided me, I started seeing a difference in my legs, where I once had a lot of cellulitis to the point where I would not wear shorts. I am now to the point where I'm comfortable showing my legs.